Thursday, January 20th marked the first day of classes at Boston University, but bringing with it was high COVID case numbers across the campus and the country, and a still high concern for the Omicron variant. As such, BU has shifted regulations in an effort to get a handle on the virus. I sat down with the Director of Student Health Services, Dr. Judy PLatt, to go through BU's plans for the semester. Hi, Dr. PLatt. Thank you so much for joining us. So I, along with other students, was relieved to hear that classes would be held in person for this semester. But due to Omicron's quick spread and an almost 10% student COVID positivity rate last week, what are BU's plans for rising numbers? Do you think there's a possibility of returning to the LFA model? If so, is there a certain number of positive cases or another milestone that would require such changes?
Well, Alex, those are really good questions. So first, one of the things that we have been fortunate to do with our regular testing is to keep viral transmission relatively low on campus. But of course, we know the campus is porous, right? It's not a bubble. And so we know that people have interactions off campus, at their homes, with other friends and colleagues. And so it's not going to be possible to have no cases. And certainly that was never a possibility. I think what we're really trying to acknowledge now in this phase of the pandemic, not just here at BU, but at other schools and colleges, as well as even across our state and this country, is that the Omicron variant is very contagious. We expect that people will get sick, not sick, will be diagnosed with COVID-19 because we're looking for it here at BU and we're testing for it. However, we've been fortunate thus far that most of the students, faculty, and staff that we've been in touch with have not gotten significantly ill. So I think the important piece really is focusing on being boosted. If all of our community is boosted, we have the best chance of really limiting the impact that COVID-19 has on us. And the goal is to keep our residential campus open and to keep our classrooms open. We know that is critically important.
What is BU's plan to limit crowding and long wait times at the 808 testing center? Do you think the school will open an additional center for asymptomatic testing?
So you've touched on something that's really important that we are actively working on now. We are going to be transitioning to all unobserved testing. So that means the testing will happen much more quickly than it did previously. You'll basically do your test at home, bring the bag in, scan it, and be on your way. So that's going to help a lot with congestion and long lines. But we also know with the increasing for the undergraduate population to twice weekly, that it's going to feel a little more inconvenient to have to go to 808. So we are working on adjusting the location so that drop-off can be at other locations besides 808. We're not there yet, but we will announce that date as soon as possible and anticipate that will happen in early February. We already had practice with this as we moved employees to unobserved testing for the fall semester. And actually the biggest point is just the distribution. How do you get the first test to people? So you'll go to the site, pick up your first test, and then once you drop off a test, the next test kit will be given to you. So it'll really be a distribution that focuses on each time you return a test, you get a test. We want to do that as opposed to just giving people multiple test kits to have at home or in their dorm rooms. We know they get lost. And there is a cost to these testing kits. So we want people to keep one test kit on them, keep it where they can remember it, and when they turn it in, they get a new one for the next time they have to test.
Last year, students who left the state for Thanksgiving break were asked not to return until spring semester. Is there any talk of travel restrictions, rules, or recommendations for spring break?
Oh, Alex, that's a really good question and a really important point. So I think one thing to recognize is that if the state has travel guidance or travel quarantine in place, we have to abide by the state rules, right? That's something that we need to do because we are living in the state of Massachusetts, our colleges in the state of Massachusetts. However, we do not anticipate at this time having travel restrictions in place that are more conservative than the state does here at BU. Again, we know people have to travel. We saw what happened with travel over Thanksgiving, and as well, we'll see what happens as students come back in greater numbers. We know there will be more cases. I think the important advice for anyone who travels, usually it's not just the travel that can put you at risk for getting COVID or getting the flu or getting anything else. It's the different people that you're seeing, eating dinner with, spending time with. Do a rapid test before you come back. It is no fun to get back onto campus only to go into isolation, right? So do a campus, know before you travel, because usually it's not the traveling. If you're wearing a well-fitting mask and minimizing the times when you remove that mask, it's not usually the travel that poses the biggest risk for infection. It's all the people you hung out with right before you traveled.
Finally, you previously mentioned that you were optimistic about returning to campus. Why is that? And what do you think BU has done well so far, or what do you think the administration and community could do to improve?
Well, so first, I think that our entire campus has been aligned in sharing this responsibility of minimizing the risk of COVID. And I think that's important. Unless the whole campus is aligned, everything that we provide doesn't really matter. So that's been the first and foremost issue. And I expect that that will continue for the spring semester as well. Secondly, we do have a very robust system of testing, contact tracing, adaptive testing, providing isolation housing, as well as mask mandates and vaccination mandates. So all of those layers together are really important for limiting the risk of viral transmission. But the other thing that I'm really hopeful about is that we, as our population continues to be very highly vaccinated and boosted, we will see less and less people getting severely ill. And as I said before, our goal is to keep this campus open. The pandemic has had a significant effect on people's mental health, physical health, overall well-being. Coming together, building community, building connectedness is really something that's exciting and inspiring to me. And I think with our protocols and with the cooperation of our community, we'll continue to do that and weather this surge in the spring.
Thank you for joining us, Dr. PLatt. We loved having you.
Oh, thanks so much, Alex. Really appreciate talking with you today.